Good day everyone. I'm Professor Shahid Hassan and you are watching the micro-learning skills procedure on examination of larynx called laryngeal endoscopy. This micro-learning lesson includes a couple of slides, quiz and video that will not take more than 5 minutes. Quiz are inserted for you to answer some relevant questions to brainstorm your prior knowledge, which will help you in your TBL session on hoarseness. For quiz, you may pause the video, read and answer the question, and proceed to read the correct answer. This micro-learning content is the second of micro-learning course on laryngeal examination, and the learning outcome is to know how to examine the larynx using 70-degree endoscope. Laryngeal endoscopy examines larynx from inside to observe some of the important structure inclusive of vocal cord and its mobility. This is an acceptable procedure for undergraduate MBBS program against a must-know procedure which is ideal and has been covered in a previous micro-learning content you may observe. Among another one which is optional and nice to know procedure is the direct laryngoscopy. Rigid endoscopy is performed as an office procedure using 70-degree endoscope, which is introduced per mouth and is held beyond the uvula with lens facing downwards to capture almost 8 to 9 structures of total 11 structures in a sequential and orderly manner as you move around with your endoscope. Vocal cord mobility is also tested by asking the patient to say ah or e, and the observer will observe the vocal cord as normal, sluggish or fixed. Using 70-degree endoscope as an office procedure, we examine larynx for its all important structures of vallecula, epiglottis, vocal cord, false cord, anterior and posterior commissure, aryepiglottic fold, piriform sinus, and the other two structure, ventricle and the pharyngoepiglottic folds, are less likely to be examined. However, with careful maneuver and manipulation, you may also examine those two structures. Now it's time to watch the procedure and take your quiz. The quiz items of the question will appear during the video. You may pause and take down your answer, and you may check your answer provided towards the end of this video in a tabular form. Please bear with me the background noises because the intention was to show you the real-time video. And please also take note of a ENT clinic equipped with endoscopic procedures. This is the spray. Question number 1. What is the structure labeled 1 in this picture? Question number 2. Name the depression pointed by an arrow in label 2 and what is its significance? Question number 3. Name the structure seen inside the larynx labeled 3, 4 and 5 in picture above. Question number 4. What is the arrow pointing towards in label 6 and what is its clinical importance? Question number 5. What is the structure pointed towards in label 7 in picture above? What is the structure pointed towards in label 8 in picture above? Number 7. What is the structure labeled 9 in this picture? Question number 8. What is the structure shown in label 10 between and below the two vocal cords? In summary, laryngeal endoscopic examination is a clinical examination which is often misunderstood by students as if an investigation like gastroscopy. The other two rigid endoscopes are 0 degree and 30 degree, used to examine the nasopharynx and oropharynx respectively. Besides, we have the flexible nasopharyngoscope or nasophryngolaryngoscope, which can also be used to examine the structures in larynx which cannot be examined using the rigid endoscopes for reasons like in children or elderly patients. The projected view of larynx on monitor can be seen easily by the trainees, patients, or their attendants if it may required. Now it's time to check for your quiz correct answer, and if you score less than 10 marks, it's time to revisit your anatomy of the larynx and watch this video again.